There is an ongoing nationwide shortage of some common pain medications. That's according to Health Canada. Pharmacies across our country have been forced to react.
We're hoping that we'll get some in again soon. You're trying to limit people to like 30-day supplies instead of 3 months, trying to make sure we can, spread it around so everybody gets some. It's not that we're trying to deny you the medications. We're not trying to make your life difficult. It's just we can't get any.
So that's a pharmacist speaking to us from Edmonton. So how long is this going to last, and what can you do in the meantime? Here to help us answer those questions this morning is Dr. Sadaf Fazil, Director of Professional Affairs with the Canadian Pharmacists Association. Good morning.
Good morning.
In speaking with some pharmacists yesterday, I understand that the messaging from Health Canada isn't super clear as to the why, just that it's happening. But pharmacies, we know, are struggling to get medication out right now, which means people who need it might not have the access that they're used to. Health Canada said it's supply chain, but digging deeper into that, what part of the supply chain are we struggling with?
Thank you so much for having me. Yes, we are facing a national shortage of prescription pain medications that contain acetaminophen with codeine and acetaminophen with oxycodone. The supply issue is due to the disruption at manufacturing level by one major supplier, which is causing a rippling effect for other manufacturers to fill the gap, which is causing this shortage. Now, drug shortages can happen due to many reasons. There could be a shortage of active pharmaceutical ingredient, or otherwise known as API. There could be some supply chain issues. So there are some issues that are happening at the manufacturing level that is causing this shortage at the moment.
And just to be more specific, my understanding is it's mostly T3s and Percocet, so Tylenol 3 and Percocet, which if you've ever had any kind of dental surgery, for example, you're familiar with the prescription of Tylenol 3s. Health Canada says a significant shipment is going to arrive at some point in early August, so that could be as soon as Friday. Do you think it's going to be enough to ease the shortage that is being experienced right now?
We have been told that there would be a major resupply that should fill the gap that we are facing at this moment. But we are anticipating that this will resolve the current supply situations, and we will feel that patients will be able to get their medication.
When people hear that they're not going to be able to get their pain medication, especially if it's something that they're using for chronic pain, they can feel a real sense of urgency or of panic. What's your best advice?
So the good news is that we have alternatives. So I just want to give the message that we should not panic. There are alternatives available that your pharmacist and doctor can choose based on your condition, based on the previous therapy that you have used, and help you to navigate this shortage. So it's not one of those, it's not an off medication shortage that there is no alternatives available. So I would advise patients, go talk to your pharmacist, talk to your doctor well in advance before you run out of your refill medication. They will work with you on an individual basis, try to find the best solution that they can, so you can navigate this shortage.
Dr. Fazil, my understanding is most of the medications that we're experiencing the shortage of are manufactured here in Canada, but it's the ingredients that we're having trouble getting. So can there be anything done to prevent future shortages? Different suppliers, maybe?
That's a very good question. So we work very closely with Health Canada, manufacturers, suppliers, and other stakeholders. And that's what we are advocating as an organization, that we would like to get this supply chain issue resolved so patients don't miss their medications. We are in close contact with Health Canada, monitoring the supply and trying to bring the updated information to our members, to the patients as soon as we can. We are advocating for a national drug shortage policy so people can face the drug shortages in a much safer way and in a much quicker way.
Dr. Fazil, thanks so much for your time. Appreciate it.
Thank you so much for having me.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.